Have you ever been on a plane in turbulence? Like, some bumps are normal. You barely look up, you keep scrolling, you keep eating your snacks, like, you know what, we're fine. But then there's that turbulence, right? The kind that makes you sit up straight and wish you would have paid attention to the safety demonstration. Yeah. Leading right now in community health is similar. The challenge isn't that times are turbulent, tumultuous even. It's knowing what turbulence is just noise and what's a true signal requiring leadership action. Because in community health centers right now, you're carrying everything at once. Patient care demands, staffing strain, compliance risk, budget, pressure, change, and somehow you're still expected to innovate, still expected to inspire. And the risk, though, is real. You and your teams burn energy responding to what's loud, and you lose capacity for what truly matters most. In times like these, people don't need perfection. They need leadership. And leadership right now isn't reacting faster. It's creating calm clarity so folks understand what deserves attention, what can wait, and how we'll respond as an organization. It's this type of clarity that protects capacity. Because if everything is urgent, then nothing is. And your nervous system, by the way, and your workforce can't run on red alert forever. So here's a simple tool that you can use right away to help with this issue. I like to call it the signal versus noise filter. When something pops up and it feels urgent, like everything does right now, right? I want you to ask yourself 3 questions. Number 1, does this affect patient care, safety, or access in the next 30 days? Number 2, does this affect workforce capacity, burnout, or retention? And number 3, does this affect compliance, liability, or major operational risk? Now, if it's yes to 2 or more of those 3 questions, that's a signal. It deserves leadership attention and clear organizational communication. But if it's yes to 0 or 1, it might still matter, but it's likely noise for now. Monitor it, but don't mobilize the whole organization around it, because it can easily become a distraction and a huge source of stress and fatigue, which we don't need any more of. So after you identify the signal, then ask yourself this: what's the most curious response we could take before we lock into certainty? Because curiosity keeps you adaptable, and adaptability is how you lead through turbulence and to innovation. Here's the takeaway. A signal isn't what's loudest. A signal is what changes care, capacity, or risk. And I know your calendar is packed and professional development can feel like just one more thing to do. But CHI is a signal, not noise. Come get the tools to lead what's next. I'll see you there.